Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of renal cell carcinoma. First important is what is the investigation of choice. Obviously, the diagnostic investigation of choice is a CT scan, and this is almost 95% accurate. But the most accurate investigation, if you were asked what is the most accurate non-invasive investigation for detecting the tumor thrombus in the renal vein or inferior vena cava, it is MRI. MRI is the most accurate non-invasive investigation to detect the tumor thrombus in the renal vein and inferior vena cava, and this MRI can distinguish between the tumor thrombus from the bland thrombus, that is the tumor thrombus due to the tumor, and the normal thrombus can be differentiated with the help of the MRI. Okay, next, for diagnosis it is CT scan. For the diagnosis of tumor thrombus, the investigation or most accurate is MRI. Then we can also do inferior venogram. By inferior vena cavogram, if you remember, always the tumor spreads from the yes, the tumor spreads from the kidney through the renal vein into the inferior vena cava. From there, it goes to the heart. So, inferior vena caval blockade is more common in the renal cell carcinoma. So, as a result, in order to know the inferior vena caval involvement, the thrombus in the inferior vena cava can be found by MRI. But whether there is tumor mass or not, or if there is smaller thrombus, all of them can be found out by this inferior vena cavogram. But it is an invasive test. But it is an invasive test, but it detects whether the inferior vena cava is involved or not. Then we can also do renal arteriography. Why is renal arteriography is done? If we have to do partial nephrectomy. Partial nephrectomy is done if the tumor is less than 4 centimeters. So before we do partial nephrectomy, we will have to do renal arteriography. Okay, to know the condition of the arterial system, we do renal arteriography. If renal arteriography cannot be done, then sometimes 3D, three-dimensional helical CT can also be done. Okay, then obviously all these are high-end investigations. Plain X-ray can also show central calcifications. Though plain X-ray cannot be used for diagnosis, it is nothing specific, but you can see calcification in the plain X-ray.
thank you and thank you for watching.